peer learning session today. So first, and I just wanted to take a few very brief minutes at the top of this call because it seems like our world has certainly been turned upside down since our last call with everything that's going on with the COVID pandemic. And just say first and foremost, I know everybody on this call and everybody in their communities is dealing with a lot right now in your own community. Uh, you know, I certainly, since getting into recovery, have not experienced something like this. I can remember post 9/11. I can remember post financial crisis. I was not sober during those times, so I wasn't, as in tune to the need for services and emergency operations. But a lot of you are involved with nonprofits, a lot of you involved with treatment facilities, a lot of you are involved, as we are, with recovery support organizations. And I think that this pandemic and what is going on a federal and state level has really shown a light on the need for us to have some real gap filling services and contingency plans in place. I know many people are working day and night trying to still provide services while being able to keep that social distancing in place and these CDC guidelines. And the population that we work with and our population and our people, we know how hard that can be. I think that it's really important, first and foremost, that everybody, our leaders, our community, our friends, this network of people, that we continue to rely on each other. And that we recognize that in this new era of which we are in, I guess we could call it social distancing, that we all, keep, I guess, what you could call emotional proximity, which I think we've seen a lot. I have been fascinated and grateful to see how quickly the recovery community has been to respond to the needs for emotional proximity. Through means, we obviously connect through Zoom. We use digital as something because we're all scattered around the country, but being able to see different recovery support organizations and recovery groups and recovery community orgs really step it up, quite frankly, overnight, and find new innovations and the tools that they have at their disposal to use to keep that emotional proximity and to keep services going. And while I know a lot of that work is in direct services, I just, as an organizer, I can't help but mention and put an asterisk on that and say that that's really what, community organizing is all about. I mean, you take, you're dealing in the unknown constantly, and you look for what resources you've got at your disposal and you put them to work. And I think that that's what this COVID-19 has really presented itself to the recovery community as. And we've been looking for tools that have been at our disposal and things that may not necessarily cost money, because a lot of our orgs and our constituencies don't have funding to keep expanding services, but we have found ways to keep providing those services. So, stay close to your local community. Keep doing what you're doing. You can always, pick up the phone or email, reach out to me, reach out to Aaron, reach out to anybody on the RAP team. We want to leave some space at the end of this call because I've received phone calls from a lot of folks in different states on particular issues that they're seeing around recovery housing and other issues that they'd like to address as a network. And we certainly, want to address those and see how we can, as a network, be able to take them on, but also to leave some space at the end of this call just to kind of do a check-in, because I think it's important that we do that as well. So again, I always like to say, we see you, we hear you. I'm grateful for everything that I'm seeing, but we're also here for you as well, because it is a very, very strange time that we're living in right now. And with that, I'm going to kick it to Aaron to kick off this call. And also, I know, on this Thursday, thank you for jumping on, because I know there's a lot going on. Thank you for jumping on, and we're going to keep doing this work because we've got to keep going.
Yeah. Thank you, Ryan. I echo that as well. I think that if there's one thing that the recovery community is good at, getting through things together, and adjusting together. And so it's good to see everybody. And I just wanted to talk about community listening forums just for a second before we have our leads kind of go into their experiences with it. I know in this time of social distancing, I see the irony of us talking about doing community listening forums. But the point is that the Recovery Advocacy Project was created to teach people, and we want people to have these skills. We want to make sure that the campaigns that we're doing are grassroots guided. Now more than ever, we have a whole new set of unique issues and different issues that we've never really had to deal with locally. I mean, it was hard before in terms of advocating for services and advocating in our communities. And now we have a whole different set of things and a lot more reasons to be thinking and acting locally. And so you're going to be learning about community listening forums, recovery community listening forums today. Keep in mind, as we're adapting as a recovery community, if you need help to host these forums digitally, we want to be able to help you do that. A lot more people are picking up on Zoom these days, which is good, or Google Hangouts, or there's a few other platforms that people use. And so we can do some of these digitally in order to make sure that the campaigns that we're creating for our states and our communities are guided by the grassroots. And the last thing I want to say about community forums, you can still do I know that one of our leads is going to share that he did his in a recovery home. So if there are homes that already have people in recovery, if there's different sort of groups of clusters of people in recovery, and you feel comfortable doing one of these in those spaces, if it's appropriate, you can do them in person. If not, we can do the digital sort of stuff. We just want to make sure that everybody's being healthy and not putting people at risk. And so, some of the things that people are going to share, about the community listening forums, keep in mind they did these weeks ago, or a month ago or so. And while people weren't practicing social distancing. And so we're adjusting how we organize. I think that, for the months to come, building that digital capacity is more important than ever. And we're going to give people some time at the end of this training and this learning session, some space to talk about some of those new barriers and unique things that are happening in their communities. And we're going to work with you all to create campaigns to address them. And so I want to turn the floor over to our Indiana State leads, who have done a fantastic job over the past month. They're kind of like our guinea pig test pilot. Let's do these forums and see what happens. And they've done an amazing job. And so we wanted to give them some time and some space to share with you how they did them and some of the experiences. And so I want to turn it over to Megan first, I think, Megan Fisher. And I think Jerry and Tyson are going to speak right after her. Take it away.
Thanks, Aaron. So, yeah, my name is Megan Fisher. I'm one of the Indiana leads. I am a person in long-term recovery. So what that means to me is being without alcohol and substances for 10 years, 11 months. In April, God willing, we're going to reach the 11-year mark. So our team has done a few listening forums, and the way I understand them is there's a couple points behind them. One is to start to build our numbers, because the actions that we put together through our network and some of the activities and campaigning that we're doing are more effective with larger numbers of people behind them, right? So having these forums is a way to start building our communities and identifying people that are going to be a part of our action teams moving forward. But it's also a vehicle to really hear what the local communities have going on. And so our Indiana team, we've already started noticing a theme. So there are going to be some things that we hear in all of our communities, and we can do statewide campaigns, but there are also going to be some topics that are very unique to each community that we, work with and listen to. So we'll have to have narrower campaigns for those communities. So when I held mine, it was just as simple as can be. Like, I think my main point is it's not like, it's not anything to be scared of. It's not, it's not this crazy intense, like formal thing that you gotta get all jazzed about. I literally so one of the guys, I can't remember if it was you, Aaron, or if it was Garrett, who created the first event within the Action Network platform. And then for mine, I literally took like what they created and copied it and just and like changed the details in it to match the meeting information that I was having. So like I just edited in there and typed in that it was going to be at our local recovery house where I go to, my home group. So that's what I chose, was like the recovery house where I go to a lot of meetings. And I was like, hey, can I use this room for an hour? And they were like, cool. So once I knew where it was going to be, what date it was going to be, I used the Action Network to create the event and just started splashing it on social media. Just put the tag in there for people to click on the link and they could RSVP if they wanted. I threw in my email address on some of my communications. So if people were unsure about the Action Network and they just wanted to toss me an email and say, hey, I'm coming, they could RSVP that way too. I made some really simple flyers and I left them at some local meetings that I go to and to some local organizations that I'm kind of in and out of. And that's really all I did from an advertising perspective. I didn't get like kind of crazy about it. And I ended up with, I think it was 11 to 13 people in my group. And so the night of, like I went to the grocery store and grabbed a bag of cookies and brought them there, and they were like cool cookies. And so as far as the format of the meeting, I just introduced myself, why I would, what our whole, recovery advocacy project is about, how it is, about hearing their voices, that we're used to this top-down model and people in the government telling us what we need to do, but those of us in recovery have an experience and a voice to share, and we all have unique experiences, and we wanted to hear from that and build from that. And then I introduced kind of a little bit about myself, not that this was a time to like give a lead or anything, but just, who I am, that I'm in recovery, and why this was a passionate thing for me to be involved in. And then we went around the room and did some quick intros on who was there, just so I had an idea of like, what kind of mix we had in the crowd. And then there's a resource tool that the guys have available for us, where it has some questions that you can pull from when you're running these. And I probably asked 1 or 2 questions to get the ball rolling. And that was it. Like an hour of conversation exploded from there. Really great discussion about all sorts of topics, and I just let it flow. I was a facilitator. I didn't want to insert my opinion into the conversation, because I really wanted people to feel like they had a safe space to say what they had on their minds without any perception that they were going to be judged or anything like that. As a part of that discussion, some controversial topics came up. One of them, which is often controversial, is medication-assisted treatment. So that came up, and there were different opinions in the room, and there were certainly opinions in the room that were different than my personal opinion. And I think my approach was similar to my approach in recovery. When I'm in a room of recovering people, I look for the common ground, right? Not like what makes me different from everybody else. So as a facilitator of my meeting, I was looking for where's everybody in this room on the same page, so that we can take those as our building blocks for campaigns moving forward. Because I didn't want us to start off divided, right? So if there's something that I'm identifying as a pretty controversial topic, I sort of just cataloged it and went, okay, that's something that we can get to later when we have a good cohesive group built. But for now, let's start with where we all have common ground and we're all on the same page. And for us, that was some pretty, I'm sure, common themes that you guys hear: housing, transportation, stuff like that. So after some really great conversation for an hour, I said, you know, let me run down and kind of prioritize what I heard were some themes that happened over this last hour. I laid out like the top 3 topics that I had heard and said, does that make sense to you guys? Does that sound like what you were saying are our priorities? And they said, yep. And I said, great. I said, we're going to be having more of these listening sessions throughout the state. We're looking for themes. And now that we know what the priorities are in our community, I need you guys to go out there and kind of talk to, you know, the rest of the recovering community that you interact with. And let's build our numbers and let's share what's important about this. And we'll meet again, you know, when the time is right. And that was it. And we just left it as, thanks for everybody coming out, take the cookies home with you. And, and so it was really simple, really informal. And it was a great start to a lot of good relationships. So that was pretty much my experience.
Yeah, I just want to, one of the things that Megan was referring to, we do have some helpful one-pagers that we're going to send with the recording of this, that will help you to organize. There's basically a one-pager that's just how to organize a community listening forum, real kind of takes you step by step. And then also we have there's a sample agenda, and Jerry's holding that up right now. There's a sample agenda, and I know a few of you have it because we know that you're doing listening forums, and so we sent you some of this stuff in advance. But soon everybody will have those 2 one-pagers. Thank you, Megan, for sharing. I think that, you know, that piece about finding the unifying campaigns is the most important. You know, there are some issues that divide the recovery community, like real quick. And, you know, we're not quite in that stage right now. We want to make sure that we're bringing everybody together, attracting people to the Action Network stuff and our state campaigns. And so thank you for pointing that out. Tyson, I know you're on a, you got to be somewhere. No? Okay. He doesn't have to be anywhere. Jerry, did you want to share next?
Can I say one thing real quick? Because Megan said something super important, and we're going to do a training on this during the summer. It's probably going to be multiple tiers, but she had made the mention that she shared a little bit of her story, and while this isn't about her, it was important for her to do that. And I just want to add to that. I used to feel the same way. Well, it's not about me. It's not about me. So let's like get right to business and hear what other people want to say. And as many of you know, I sent around some information a couple of weeks ago, and I'm going to be sending more. The power of the personal narrative is actually incredibly important in community organizing and in the work that we do. Even if you're talking in the recovery community, one of the things we have to do is legitimize our position to be able to take a position and to be able to be organizing in this way. And the most powerful way to do that is your personal narrative, right? And doing that story of self. And then hopefully collectively, once you do these recovery listening sessions, you can start to figure out what your story of us is, you know, which is more around the shared common values, because we're eventually going to need to be telling that story of self, story of us, story of now, right? Why we need to be taking action to the outside community as well. So it don't ever minimize, you know, the time or the space in doing that story of self, because it is probably the most important part in community organizing, whether it be in recovery or healthcare or any other issue. It's incredibly important and gives you a much higher ground to take the issue on. So I just wanted to add that.
Yeah, it allows people to connect with you, and for you to put yourself out there and share about the issues that you care about. If you want some pointers on how to tell your story and some of the language that you can use, what some of the language you shouldn't use, that there is a how-to on the Recovery Advocacy Project website, in the advocacy guide, that you can review, before you kind of um, kind of come up with your Recovery Advocacy Project spiel, or share some of your story. There's some pointers in there. It's not to change your story. It's just to give you a vocabulary and a language that won't like feed into the stigma, right? And so that sort of stuff is on recoveryvoices.org. So Tyson or Jerry, who wants to go next?
I can see Jerry, so let's go with Jerry.
All right. Hello, everybody. I'm Jerry Z, and I'm from Indiana as well, Central Indiana. And I'm a person in long-term recovery. And after Megan said that, I was like, how long do I have? So 14 years, 4 months, and 5 days, but who's counting? And what that means to me is that I use no substances, and alcohol is a substance for my body. So, and I had a listening forum with some people that I knew of. I invited them because I knew of them that were in recovery and work in the field. And we had 5 people show up, so it wasn't huge. We met at a coffee shop, and we just prompted the conversation with what we do, why we're here, why I asked them to come, on that day. And they asked me a few hard questions in the very beginning, like, is this going to take away our funding for where they work? And I was able to connect with Aaron and Garrett and said, nope, this is separate. So that was good. And I was grateful that they were able to respond to me in a timely manner, so that I assumed, but we should never assume. And then a lot of similarities. We also got on the medical assisted treatment and MAT stuff. And I was feeling a little bad about this, but I guess after Garrett just shared, I don't as much. I just said, I understand we have a stance on that, but what I said was, I have a daughter and she's 17. And if I had to choose whether she's on the streets getting drugs or getting what she needs to get well, I'm going to choose the latter. And they were all like, oh yeah, that's true. It's easy to judge people over there, but when it hits home, I think it makes a difference to how you react. It was very casual. We went overtime. We didn't want to leave. The conversations were great, and made more connections. And I'm trying to set up another listening forum in probably via Zoom now, in light of recent events, with the RAP team in Kokomo in Howard County. So I had Jamie Whitaker. He tried to get on yesterday and participate, and I was hopeful he would be able to get on today to hear more about what we're doing, because he's a big advocate for recovery in that Howard County area. So I'm trying to get my next one scheduled as well, and just trying to take professional voices and people who are living in halfway house, sober living, those kinds of things, and just bring them all together. And they provided us with the materials. So that was, and people, if you're like me, a lot of us like to talk. So it wasn't that hard to get them talking. And it was very interactive, and it was honestly fun, to be frank. That's all I got.
Yeah, that was one of the things that Megan had said when I first asked her about the listening forum. I was like, she's like, I barely spoke. I did all the talking, And so the purpose of the facilitator is just to keep the dialogue going and work to, keep note of what people are talking about, so you can kind of summarize things at the end of the forum. So, Tyson, do you want to share a couple minutes?
Sure. Yeah, I'll jump in. All right. So I'm Tyson Cargill from West Central Indiana. I'm in long-term recovery since November 18th, 2016, which means I haven't had any mind-altering substances in my body since then. This listening forum was it was a learning experience for me. I feel that next time I approach this, that I may ask the people maybe where it would be convenient for them to meet rather than what is convenient and what I think. I had, I don't know, like 16 people RSVP. 50% of those people showed up. Um, it wasn't about the quantity of people, but it was very quality individuals. We had a very quality group. I left my ideas out of the whole thing, and pretty much, you know, I set the guidelines, and they did all the talking, all the writing. I used what Jerry made up a sheet for people to fill out, and I used that, and it came in pretty handy. It's going to come in real handy when I go to enter this information into the Action Network. Main issues were, as Megan said, transportation, housing, lack of community support. The recovery community here in Vigo County is very strong with the people who are in recovery. However, the people who aren't in recovery are still, it's a little slower, you know. I had one judge and one public official come, and they are very interested in, you know, getting involved in the community. So most of all, like I said, I think it was a learning experience. I can't wait to do another one. I learned a lot from, you know, whether they were mistakes or whatever. You know, I was going to have it at the local RCO. Their hours, they close at 5 o'clock. A lot of people get off work at 5 o'clock. You know, I'm beating myself up with my good ideas again is what I'm doing. So, you know, I think next time I'm going to ask people what's convenient for them, where they would like to meet at, and then go from there. But once again, man, we talked for probably, I don't know, 2 hours.
Cool.
Mine was minimal talking. It was them engaging. We had cupcakes and coffee, and you know, so I think it went well. I do. Of course, I'm a perfectionist, so it can always go better. So, you know, I think that's all I got. There was a little issue on the, like I said, the MATs and the housing with there's recovery works out here in Indiana, and in order for these recovery homes to get the recovery works, they are now ordered to take people who are on MATs, and they are complete abstinence programs. So they're like, hey, we'll just shut down before we do that. So that's not an issue like today, right now, but I foresee it being a problem here in the future.
So Tyson, thank you. I was just messaging Aaron and saying I wanted to jump in really quick because I just want to put this now into context, right? So over the course of 30 days, 3 different state leads that came to this in the state of Indiana, pretty much just 3 individuals, right, through the network, got together, had 3 different listening forums, who have now grown their state network to over 25, if I'm counting right, in the state, right? And that was through just some initial cookies and coffee and conversation and listening, right? They've now engaged, you know, over 25, which will be a part of their network. This is what is like in true community organizing. This is how it happens. They're going in the surface of the community, underneath the surface into the community that's impacted, and they're growing this snowflake, right? So like, this is what's the snowflake approach. It's going to keep getting larger, and now you're going to have more community listening sessions, right? So I mean, this is how you grow your network, and these are the most important part beyond like the personal narrative piece and the why and like the call to action is bringing this community together. And this is how you do it. And in a state like Indiana, again, with not much resources, right? So, I mean, they didn't have to go out and spend a bunch of money to do this and reach this. They just went to where they had some resources and pulled some people together to listen to them. This is how we do this. I just wanted to say, great job. And super exciting. And I think it's, you know, between 3 leads and conversations with 25 people over the course of a month that are now, you know, engaged in the network. that's a huge accomplishment. And thank you.
And the other smart thing that Indiana Leads did, and talk to your other state leads about this, just in terms of where you live in the state. They realized, well, I'm in northern Indiana, and then this person's in central Indiana, and this person's in the south part of India. So we will just split up the state and be responsible for those regions. And you want to be able to touch some of the rural counties. If you live in a rural state, you want to, the issues are going to be different, in cities and rural areas. So we wanted to open this up. Yep, go ahead.
Really quick, before we're going to jump in to kind of an open forum on the COVID stuff, and I just hearing from you, but before we do, Sean, are you still on? Because Sean, I just wanted to, he's got some tools for folks on listening sessions if they want to use Zoom. And also there was Sean, are you still on?
Yeah, I'm still here.
Okay, do you want to take maybe 5 or let's say 7 minutes max, and then we're going to open it up for open conversation?
Sure.
Great.
Yeah, sounds good. So I know that with like the COVID stuff, obviously all of us are rethinking how we're doing a lot of our organizing and work in general. And I don't know if some of you saw a new webinar series that we came across that I posted in the Mobilized Recovery group. But I'm just gonna share my screen real quick and show this to you guys along with a few other resources. So then our organizing and advocacy work doesn't have to slow down. Here we go. Can you guys see my screen okay? Yeah. So the Organizing Empowerment Project is an organization. You can go to organizingempowerment.org to get to their website. They actually, I find so much great information through them, but they have just kicked off a brand new series, a web series that anyone can join for free. And it's the Organizing from Home Academy. So it's an ongoing series while we're all, social distancing and, some of us are staying at home. It's going to continue, the series will continue through all of this. And they go over so many different great tactics and resources and guides and free tools that all of us can be using. And what's awesome, what I like about it too, is that it's obviously you're on the call with a bunch of other campaign organizers and leaders that are outside of our space. So, we're on these calls with like 300 different people, and some of them are organizing for different, electoral campaigns. Some of them are organizing for different issue-based advocacy campaigns. So we all like in the chat, and it's all through Zoom, just like this. So in the chat, we're like bouncing ideas off of each other while they're giving their presentation. So it's been super awesome. And they actually, for the Organizing from Home Academy, they are breaking up this series into 3 different tracks, which is organizational leadership track, a track for organizers, and then a track for activists and volunteers. So in addition to you guys joining, if you want to do like the organizational leadership one, for example, tap out to your networks of other folks and see if they want to join on the activist volunteer one or on the organizers one. They're going to be talking about a bunch of different things on each of those tracks, or you can attend all of them. Like I said, it's completely free. So check out their website. I'll keep like an eye open for their emails for when they're launching the next ones, and I'll post those in the Mobilized group and online and stuff. But we had our first webinar today, and it was awesome. They went over things like lit dropping and organizing a phone tree to stay active. Obviously Zoom is offering free trainings right now. And a few more resources. So this is great. And then I'll just point to a few more places. Zoom, like I just said, they've put together this brief little landing page during the COVID-19 pandemic. Here you can find a bunch of like helpful training guides and tools to how to use their stuff. And down here at the bottom, they also have a whole section on hosting virtual events. So we can still continue to plan our community forums and just host them online. So that's a great resource. Another one real quick that I came across, actually from the Organizing from Home Academy, is called Training for Change. And I really suggest you guys check it out. It's trainingforchange.org. And here, I mean, I'm looking at specific tools for online trainings, but you can find different like tools, activities, and ideas and resources that we can use for online trainings and webinars and things that we're doing, along with a bunch of other like strategies and tactics. Eventbrite has put together COVID-19 resources and FAQs, and this is specifically for like us organizing events still during this time. And then lastly, Ragtag, if you guys aren't familiar, Ragtag is a progressive group of technologists and like web designers who volunteer our skills. I volunteer for them. We volunteer our skills to help on different progressive and issue-based campaigns. But they have a great blog series called Ragtag Tech Guides. So here are a bunch of different resources for different, types of technology that we can use in our advocacy and organizing work, like Slack and things like that. So that's all I have to share. I hope that was under 5 minutes.
That's awesome. I got some stuff to check out now.
Hey, Sean, some of the people in the chat are asking if we'll put together this in an email and I'll send it out to everybody. So you have those resources. They were asking for that. And if anybody needs help setting up Zoom meetings or some people have been asking for assistance in setting up digital listening sessions, just email me and we'll set up a call and we'll get it all set up for you and help you do it.
Yeah, I'll post it in the chat too, some of these links for you guys to check out while we finish up the call.
Did we want to move, Aaron, to this is just for the next 10, 15 minutes, kind of open space. So much going on. If you want to check in, we can check in. If you have particular issues that you want to talk about, I mean, now is the time. Feel free. I don't know if we do the hand raising because it seems like you all can unmute yourself, or do we need to do the hand raising, Garrett?
You gave everybody, I think if we just do it.
Unmute yourself. It's a small enough group and go. I know some of you had some stuff in the chat, so feel free to just unmute yourself and speak up. Go ahead, Leila, or were you just waving?
No, I'm saying hi because I got a couple things. So I am in Montana and we're a huge state. So I've been doing mostly of my organizing via Zoom before this even happened, because I live in Missoula and like the next largest city is in Billings, which is like 5.5 hours away. So we've been so a lot of people now have been joining in, figuring out what they're going to do next because, the recovery houses are closing. There's like 3 in the state. So it's, 2 of them already closing down and the treatment centers aren't accepting any more people right now. So there's a lot of, we have a few homeless shelters that are being overrun and they're, because people are going, from there to, the homeless shelters. So it's been just a crazy people getting, I went from like last week, like 3 people on the thing to 11 people today. So it's going to just get bigger and bigger because people are going to want to figure out where to send people. And, that's what we're, dealing with here. But anyway, Zoom has worked a lot for me because we're a huge state. So that's just, I've been doing that from the beginning. So I just want to send that. Thanks.
Thank you. Absolutely. Let's see. Feel free to unmute yourself. Mikey, I know you had some stuff in the chat. I don't know if you're still on and you wanted to speak up.
Yeah, I'm here.
Go for it. You have the floor if you wanted right now.
Yeah, sure. So kind of in light of COVID-19, there's been a lot of raised awareness from different kind of stakeholder groups across the country for needed regulatory reform. And a lot of that is centered around the MAT folks and expanding access. And obviously, the more folks we're welcoming from the drug using community into MAT is going to bring them under our tent. Like they're going to be entering into like stages of recovery and working with a provider and like doing all the things that we know we want people to be doing. So a big part of that conversation is how do we expand access? How do we accommodate telehealth? How do we build that infrastructure? How do we engage people? And then also sharing information about like safe practices. And there's major supply side issues as far as safety supplies and other things that are necessary. So we have a document that we're going to be reviewing on a call immediately following this call at 8 o'clock with the National Union, with the DPA. Hopefully HRC is able to attend. And hopefully some folks from this call are able to attend because we'd like to get buy-in from as many groups as possible and get feedback and give people a space to contribute and be a part of that process because using that kind of grassroots bottom-up model as best we can. I mean, one of the challenges of doing a truly bottom-up response model, and I don't know exactly what direction this line of thinking goes in because I have more questions than I have answers, unfortunately. But you know, from a bottom-up perspective, it takes more time, it takes more resource, right? It can be very difficult to mobilize a response with urgency. So I'd like to at least try to engage as many of our folks as we can in a meaningful conversation about contributing to this without leaving everybody behind, but at the same time, not leaving us so far behind the 8 ball that we're not acting in a time sensitive manner to urgent changes, like urgent changes. We have currently the situation in my area, and this kind of just stays within this group, but just I'm sure this is happening other places because of where we are. People have no idea how to even access Narcan.
Right.
Being so many limits around access, and for folks that are experiencing overdose, once this hits our emergency rooms, the concern is that they're going to be much farther down on the priority list, and there's no way to treat those co-populations. You have somebody who's very immune compromised, who may not be infected with COVID-19, and trying to bring them into an ambulatory setting where lots of people are being treated for COVID-19. It's just a recipe for disaster, even if they are able to get some form of treatment. So the thinking is that a lot of people are not going to be treated, and we're going to end up with a secondary wave of overdose, similar to what we saw following Hurricane Katrina. Yep. So we want to get out ahead of it and modify the regs, increase access, try to promote this to as many folks as we can, and kind of bring them into our space and start them on a recovery path, at least through a form of moderation management through MAT.
And let me just jump in there really quick, because one of the things I've been seeing also is there have been some action items that have been coming out in certain states where our network members have been able to, like in Missouri, I mean, we saw some really good work around the MAT regulations and the telehealth and buprenorphine and Suboxone and take homes and whatnot, and rule restrictions that were lifted for the crisis, and that was done in a very quick order. Some of that is short term and can be done very quickly through some relationships, but for a lot of these more systemic issues, one thing I've been doing and we've been looking at here in Nevada, and I know a few other states, is we've been figuring out what capacity we have to take on certain things right now that are very realistic, but then we've been looking at the larger systemic issues that are as a result of like just ill-advised policy, and we're seeing the gaps in services just really big right now, given where we're at with COVID-19, is keeping note of that, because we need to be able to be looking at long-term objectives, and we should be using some of this information and data and barriers to services that people are experiencing right now and lack in funding in certain services to build more sustainable solutions and sustainable campaigns towards solutions. So some of the stuff is immediate that we're trying to get done right now during COVID, but a lot of it, right, and I would say a lot, probably 90% of it, this is going to be work that's, like you said, no quick fix. It's going to take a year, 2 years, but we need to be keeping track of it, right, for now, and kind of prioritizing that. So I'm with you 100% there. Anybody else?
I was going to piggyback on that as far as something that's happening in the here and now with the COVID, but is really just shining a light on a systemic issue, is the warm handoff jail prison release into intensive substance use services. And I don't know what the trend is across the nation. I know in Indiana, in pockets, we're having jails release more vulnerable inmates from their population, you know, supposedly to protect them. However, if you look at it negatively, I think to some extent they're just afraid to have people die within the walls of the jail. So I think COVID is already existing in the prison system, and it's being kept hush hush, and it's gonna explode pretty quickly soon. So there's advocating for the rights of the people who are stuck within the walls. But then there's also the people that are getting released and released with urgency. And we already kind of suck with that warm handoff, but these folks are getting sent out without any assessment, without any, all they're doing is looking at their primary physical condition and their medical, you know, condition with respect to COVID, but not their substance use history, throwing them on the street, and we don't know who they are and how to tie them into services. So those are just some things I'm watching, and I don't have good answers, but
I would say in terms of the prison system jail work also, there, you know, I know Courtney is on the line, and she's looking at some language around potential state petitions, state letter campaigns to state legislators that I think Courtney, I'm sorry for calling you out. She's drafting.
It's okay. I was literally just about to jump in because I got all excited. But
I'll let you speak for yourself, but what she's doing in Maine might be something that she'd be willing, the Maine rap group might be willing to share with other states, that we might be able to get some traction on. Because again, like we're talking about mostly state-run prisons, right? So it's like we're going to have to deal with them again on a state level. So Courtney, I'm sorry for doing that, but go ahead and you know, if you want to fill in there, I'm sorry.
That's okay. Thank you, Ryan. My name's Courtney. I am from Maine, person long-term recovery. So I was literally just starting to draft a petition to the governor of Maine, Governor Mills, about releasing. We've done actually some amazing things. So I want to say that I've been trying to find some golden lines around COVID-19, and I feel like the justice reform movement is getting a lot of traction right now, and we can use this traction in the future if they try to backtrack on it. So right now, Maine has said that they will see anybody who is newly incarcerated every day, and that they won't arrest anybody for failure to pay fines. And there was one more, I guess it doesn't matter, but the whole point is that in 3 months, when they try to backtrack on that, we can say, hey, like, it's still not okay to arrest poor people for being poor. But for now, I was just drafting, because we haven't started releasing anybody like New York has. So I'm drafting a petition that says release anybody who is currently incarcerated and is potentially elderly or immunocompromised, and also release anybody who is a primary caretaker or of a child or somebody who is elderly, because right now all of our children are out of school and we're the oldest state in the nation. So we have the biggest amount of elderly people that we're going to have to take care of through all of this. But if anybody wants to see that, I'm going to post it soon. Or if you have any other ideas of what we can offer governors/sheriffs to do, please get a hold of me.
Great. Thank you.
Cool.
Ryan, it looks like Carol and Abigail have raised their hands. So
go for it. Just unmute yourself. Carol? Hi, Carol. Carol still on with us?
Yeah.
Let's go to the next one because I don't think she's
Abigail raised her hand.
Abigail?
Yeah. Can you guys hear me?
Yep.
Hi, Abigail.
Okay. Hello, this is Abigail Wells from Oregon. We are kind of in the midst of the COVID-19 right now. In fact, my workplace just got a diagnosed case as of this morning. So they finally sent me home to work from home now that I've been exposed. But I think that throughout all of this, there's definitely some silver linings and some things that I was just gonna say that we've kind of been working on. And one of those is advocacy. I think that there's a lot of people that are now homebound, and computer electronics technology has kind of become their life and their go-to. So we're working on all sorts of just like writing to your legislators, writing to your governor, advocating for anything from like, we need more public health supports and dollars, which ultimately is going to help with recovery movement and all of that. And we're writing up some stuff about the release of inmates as well, also like homeless populations, and there's just a ton of really vulnerable populations right now. And so we're working at that advocacy level to kind of figure out what we can do in regards to that. But then another thing that's an opportunity, I think right now too, to get those that you do have, like recovery advocates that are kind of unsure of what to do and they still want to help and they still want to do something, is well, of course, up and running groups and so forth through Zoom, but we're also trying to start these kind of box campaigns. So delivering boxes. So one of them that we have is like harm reduction relapse box, which we're going to put in Narcan, fentanyl testing strips, resources that are paper formatted. So some of the vulnerable populations that maybe don't have as much electronic access, that sort of thing, places that they can go in order to get that. And we have a family box that we're creating that's going to be for, families that are stuck home, and substance use disorder is going to pop up more. And so kind of like some self-care things and some, ways to work with their kids through this and keep themselves healthy. And it's a way that you can kind of like give these, get together groups of people in recovery, and if they're, still healthy, can go and deliver these boxes to the doorsteps of people and kind of just keep people more in that helping mindset. So that's some things that we're kind of been looking at doing and trying to promote in the Oregon-ish area.
Thank you. That's great. Thank you.
You guys hear me now?
Yes,
Yep.
we have one more.
Okay, yeah, my thing is, my plug's not working.
Go
So just real quick, day 2, quarantine, not having success getting a test done, just so many conflicting ways of, people. We've already had 2 deaths in Fairfield County. We have the largest amount of people positive in Fairfield County. I'm in New Haven County, but I'm right over the bridge from Fairfield County. I was supposed to have a forum tonight. I have postponed it till next Thursday just to get people on board of doing it via Zoom. So, I've had great responses. I actually reached out to our Senator Murphy, Senator Blumenthal, the mayor of my town, and several other towns, sent them an email invite to come on board, and hopefully they'll come on, they'll RSVP to come on the Zoom community listening forum next week. My concern where I was at, I was at 2 methadone clinics, very close corners with folks. I reached out to my supervisor today because I'm just giving them updates, play by play a couple times a day. My concern is a lot of our recoveries there at the methadone clinic, a lot of them are homeless as well, and aren't getting additional bottles like other people are getting. So, and I understand the whole diversion piece, but they're not getting peer support. I'm not there. I'm the only peer support and recovery coach. And so I asked them if I could get access to the database to at least, those that have phones, that I could reach out to them via phone, because I can't meet them in the community. So they're looking at that, and reaching out to other organizations to, and other recovery coaches on what they're doing in their communities too, because CCAR supposedly is still open. They had a group of 40 people in a meeting just maybe a couple days ago, which was weird. But, you know, I'm not here to judge. I'm just, you know, I want to make sure that everybody's staying safe and myself as well. So that's just my update. Oh, just, you know, just as we were on this call, Mara International and I have partnered. We're getting 2 online Zoom meetings starting next Tuesday. So Tuesday and Thursday, 11 a.m. Eastern. We're getting MAR meetings going. So we're really excited about that. I've gotten a huge response in less than like 2 hours that we launched it. And yeah, I'm supplying them with the Zoom access. And yeah, it's just a great partnership. So more information we can get out there to everyone and support is, you know, at least I feel like I'm doing something.
Carolyn, let me just suggest, if you want, on the peer support MAT piece that you were just talking about, Sean, I don't know, Sean, are you still on, or Donna? Like, maybe connect with one of them offline, because I think a lot of the RCOs are going through the same type of questions, and I think I'm always a big fan of like going through this together than isolated. So, Sean, would you maybe connect with Carol at some point about some of that stuff?
Yeah, for sure.
Great.
Also, real quick, Ryan.
Yes.
Carol, do you know, is your state doing any relaxation or extension of exception requests for your OTPs? Because there are a lot of states that are to minimize contact. So if your state's not, you know, there are protocols out there that are already, Indiana's doing it. There's some other states that you could advocate for at your state level to have them relax some of those restrictions so that you guys can be better protected. For the folks that still have to come for daily dosing and stuff, they can do exception requests.
Mm-hmm.
Right. So we do have, like, we have some folks that are in nursing homes, so they are being brought their methadone by a nursing staff and either assistant director or director. The only thing is that the nursing home will not let them enter, so they have to still come out in the parking lot. We do have a mat van, but it's only supports Suboxone. You know, getting somebody, you know, or harm reduction. So, you know, my thought was like, we have this great van, cost a lot of money. I wish, you know, the DPH would give us permission to bring methadone door to door to those that can't access it, you know, because eventually what I feel is going to happen, and it's already happening, is that people aren't getting access transportation. Our transportation companies, which is a third party, are not getting our people there on time. We have extended our hours, you know, so, but again, too, we're losing staff. We can't have face-to-face time with people. We're talking to them behind a glass door. And like, it was the hardest decision for me to make not to go into work yesterday.
Mm-hmm. Yeah.
Because that's not me. You know, I'm not a person that stands behind a glass door and not be able to greet you in some way, you know. So yeah, we're looking at a lot of things, and it also too has to do with leadership. They're communicating within themselves, but they're, you know, it's like staff is the last to hear what's going on, and it's very conflicting and very confusing. Yeah.
Thank you.
Thank you.
Yeah, let us know what we can do if you need more help for the session next
Absolutely.
week too. So I know Randy's got his hand raised. We're kind of at the end of the hour, but let's let Randy jump in real quick.
Hi, Randy.
Thank you.
Hi, guys. I really apologize for not being able to get on earlier. As most of you know, my sister's in my resident and I have things to take care of. So anyway, I just, my biggest question is, and I've now reached out to a bunch of people that manage sober homes or recovery residents here, see what they're doing, because we're getting rumors. I haven't had anything confirmed with a name yet, but where people are getting kicked out of their sober home for multiple reasons. The main one is because they've lost their job or been laid off because of this and can't pay their rent. And so I did reach out to New Way today, the person that runs their recovery residence, which is probably our largest like association, and they're currently developing like best practices. So it's like building the bus as we're riding in it type of deal. And they said as soon as they had something, they would get to me, but I just was curious to what other folks are doing. Of course, I know if I own a sober home, if I could, you know, why kick people out? You're not going to fill the space anyway. So what good does it do? But anyways, that's one thing I talked to Ryan about, I wanted to bring up. And the other thing I just want to mention, Carol, I know you and I have talked a little bit in the last couple of days. I did get an email from CCAR today, and they're not extending any CEU credits to any online virtual trainings, unless they have a little caveat that says unless we are working on a schedule of virtual training offered through producers or facilitators who have experience with, I don't know, I think they're using some of their own employees for it, but they can't because of the accreditation. They're currently, it says they're not going to award CEUs for any of their trainings that aren't done in the manner they're normally produced. So anyways, just thought I'd throw that out there. But the recovery residence is one, if anyone had a quick suggestion or what's happening around, so I can report back to our recovery residence people here, or if we're running out of time and someone wants to email me or call me, I would do that too.
Randy, I want to, because the recovery resident stuff is so close to my heart, and I want to bounce off what other people think, but where the frustration around it is a lot of governors, I don't know what they've done in Minnesota, but I know here in Nevada and in a few other states, they're suspending evictions, right? And so like that's a standing order, but sad, right? Like we don't fall under those same rules, right? Because a lot of recovery residences, it's almost like we're in a hotel. It's not necessarily a renter's agreement that we have with the provider. I think, I don't think governors or state legislators or mayors are really even understand that we don't have those same types of protections as a renter. It may make sense to, at this point, draw that attention to your state health department or to your state governor and ask them to extend, that rule or that courtesy to vulnerable populations that are living, and it's not just people with substance use disorder. We're talking about people, coming out of the criminal justice system that are in halfway houses. Like they are going to lose their jobs, like a lot of them, because a lot of folks are part-time or they're maybe not employed and they're not going to be able to pay that rent, while the economy is just in a dip for the next 30 days. We should draw, I actually would look at it as, trying to call attention to at least my governor to that problem, because that's a huge gap. That's just where my gut is. And I'd love to hear from other folks before we hang up. I foresee that as happening all over and as a big problem that's going to be the next challenge for us all to take on.
Ryan? It's
Yes.
Winslow, how are you today?
Hey, Dennis.
I'd like to get together with you on that particular project. I function with 2 recovery houses, and we're looking at how are we going to stay afloat.
Yep.
How am I going to make the mortgage payment? How am I going to pay the power bill?
Yep.
And I think organized houses need to get some support from the state.
Mm-hmm.
So I'd be willing to sit down and work with you on that.
Absolutely. I'll tell you one of the big, again, this isn't political, but it's like this huge $1 trillion stimulus package that's going into the economy. Like I wish we could get a piece of that to keep homes open and people in roofs that are, under roofs that are extremely vulnerable if they're back out on the streets. Right. So, I mean, that's something to certainly consider. Yeah.
Ryan, we need like you guys have created an action that we can pick up and blow people up. We need one letter or whatever that's something all the states are gonna want to pick up on. If somebody drafts that and we can just blow up our governor's offices with it.
Okay.
Is that possible to get that done?
Yeah, absolutely. Dennis, I'll connect with you tomorrow on email. And let's find some time in the next day or two to get together on that. Because what I'd really like to do in a good world is to bring together, so it's not just, recovery people, fighting recovery housing providers. Let's see if we can get housing providers and the recovery advocacy community together, some consensus and language around this, and then push it to the states as a unified front.
Ryan.
Yes.
Scott Brown from Michigan. Just to follow up on that, do you think that SAMHSA would have any STR grants or grants that have been already awarded that they would be willing to direct towards recovery housing in this emergency situation? And have you thought about that?
So the only I don't know around STR, SOR money for recovery housing that would be available on an emergency basis right now. That's not to say that money couldn't be redirected, but I don't, the thing about it is that given the emergent situation, I don't even think there would be time to address this through SAMHSA. It would need to be something that's addressed on a state-by-state basis with emergency funding that's already in place, you know, because the states are going to be receiving money out of this stimulus package.
Okay. You know, it kind of dovetails on something I was going to bring up. You know, my passion is substance use disorder, MAT. We have a large Suboxone practice in Michigan. And with the 1135 waiver, there does not need to be any prior patient-doctor relationship, and we can actually see patients in any state now. But kind of the holdup is there's not many ex-waivered physicians that can prescribe the Suboxone and are actively doing that. And then with them getting sick, there was a House Rule 2482 that was trying to do away with the ex-waiver and let any practitioner prescribe the Suboxone. And I'm just wondering, anyone from New York, I guess this Representative Tonko is the one that sponsored this. I'm just wondering, you know, this might be an opportunity to kind of try to do away with that waiver in an emergency situation. How would we have any kind of ideas on how we would get this in front of folks and try to get some kind of emergency action on this? And then that would open up to where we can kind of have emergency response to anybody that needs Suboxone nationwide. If
you want, email me some information after this call, and then I actually, we've seen some pretty quick, swift action on some of the federal waiver stuff that ONDCP has taken on and taken it directly to HHS. Like, let's look at it. But email me after this call, and I will ring you tomorrow.
Okay.
And network can do. And then in terms of because I want to wrap up because we're going over time.
Sure.
Like we're all, if everybody's okay to kind of look at this recovery housing.
Yeah, if you can put me on that email. I'm also concerned that us ex-waiver docs are going to be overrun. A lot of us are older and could be affected by the virus.
Okay. All right. Sounds good.
All right. Thanks.
All right. Sounds good, guys. And we'll connect on email tomorrow. Go ahead and email me about the ex-waiver stuff, and then we'll jump on the recovery housing piece tomorrow on and see how we can take this on state by state. I'll connect with NAR tomorrow about it as well. I saw your message, Carol. NAR doesn't have funding for this, obviously, but NAR would be a great partner for this campaign. Thank you, everybody. Stay safe, and reach out to me individually or Garrett or any of your
Thanks,
peers.
everyone.
We'll talk to you soon.
Thanks,
and the
everybody.
next training is April 14th. Keep it on your calendar.
Yes.
7 p.m. It's a Tuesday.
Thanks, guys.
Bye, everyone.
Bye-bye.